I'd like to welcome Dr. Robert Valenzuela from New York City. He's the Director of Prosthetic Urology at Mount Sinai. Dr. Valenzuela, we see patients requesting penile prosthesis or Penuma implant on daily basis. Should they fear these procedures?
In the wrong hands, yes. So the idea is you really need to work with somebody who does this on a regular basis. One of the key questions is how many do you do? Because you don't want somebody who does one once a month, once a year. You want somebody who's used to the anatomy, who feels comfortable in their skin doing this procedure and feel comfortable managing everything about the procedure.
This has been published extensively that high-volume prosthetic urologists have much better outcome than non-frequent surgeons. And this is not just complications, it's also the proper sizing, the proper technique to make the device last longer and be more aesthetically pleasing. Regarding Penuma implant, with the new device and the updated techniques, we just performed 2 procedures this morning, you can reduce risk of bleeding, infection, erosion of the skin, nerve injury, and potential shifting of the implant with the new maneuvers that we perform where we get into the right plane and we preserve nerves and blood vessels, and also we place it in a pocket where we minimize any type of dead space where it can accumulate with blood and other types of fibrotic tissue. I have been performing approximately between 150 to 200 Penumas every year. We are a large volume center, such as also with Dr. Valenzuela in New York City, where we perform this procedure on a regular basis, at least between 5 to 10 a week. And the more you do, the better you get. And also with the newest techniques, we have really minimized post-op complications.
Yeah, I think that's very, very important. I think when we learned the procedure, when the procedure was originally developed, and then you brought along these 10 different surgeons from different walks of life who are all experts in their field, who focus on penile anatomy, Peyronie's disease, erectile dysfunction, penile reconstruction. All these guys brought in their techniques and really showed how we have made this procedure so much safer and so much slicker. I think it's so much faster. You know, the procedure takes about 35 to 40 minutes. Patients go home the same day. They come back 2 or 3 days later to get the drain taken out. And then after that, within a week, patients can resume most of their normal day-to-day activity. Granted, no sexual activity for 4 to 6 weeks. And as long as they follow all the post-op instructions, these patients do extremely, extremely well. And the level of satisfaction is very high.
Yeah, I see patients. Last week, I saw like 4 or 5 patients from 3 years ago who were coming for other services. And I had forgotten they had Penumas. And they were like, Doc, I love my implant. And I examined them. And I noticed that the Penuma is actually much softer as it goes. It looks like part of their body. And they had no complaints. They love it. They said, you know, this is the best decision they have ever made. Obviously, there are risks that patients need to understand when you make a decision to have an implant put in a normal penis. It is extremely important to understand that Penuma implant is different from penile prosthesis. Penile prosthesis is for erectile dysfunction, and it has a function. Penuma is a cosmetic procedure where it has no function other than girth enhancement. And you have to study well all the risks before you make a decision. I myself do not perform Penuma in anyone less than 25 years of age because I was once 23 and 24, and I remember I was the dumbest kid in the planet. I took a lot of risks. So there's a level of maturity that is gained, I believe, after 25.
Absolutely, I agree. I think we came up with a good number. I think that age, you know, as we get older, we see that adolescence has been moved up. Kids that were 18, 20 years old 50 years ago are very different than what they are today. They're more like 25, 30-year-olds. So adolescence has moved up, and in doing so, you really got to find that sweet spot where men can become responsible for themselves and their actions, and they really understand it and take the time to study what it is that they're trying to achieve.
So for men who are interested in Penuma implant, you have to understand that it's a life-changing procedure. Your penis is going to be always bigger and always thicker. So you have to be cognizant. I have patients who say, Doc, I want to learn whether this penis is going to retract after I pull it in. I'm like, no, it's not going to retract. Your penis is always going to be prominent. It's going to be always around 5 to 6 inches because we're maximally stretching your penis. If that's the kind of penis you like to have, the Penuma is the right procedure for you. But if you want to have a mushy penis where it's kind of like wiggly, it will not happen with Penuma.
No, you have to be cognizant of what you're doing. It's what we say, you're going to be a shower, not a grower.
Yeah, this is going to make you a shower. And, we just rounded on 3 of my patients that had Penuma placed 3 days ago, and everyone is pain-free. We took out their drains. They're now traveling to their destinations, and we are very happy with the newest techniques that we're doing. Well, again, thank you so much for spending time with us. We are looking forward to having you follow us on Instagram and YouTube. Please visit drvalenzuelaurology.com for more information, and betterbodymd.com or penile implantdc.com. Thank you so much for spending time with us.